Dr. Justin, I was checking out your bio and different things, and you have an incredible history. It looks like in emergency medicine. So, when did the turn go towards cock rings?
I think I probably took care of about 85,000 people in the course of my career in emergency medicine. Short of a heart attack or a stroke, there are few emergencies that concern a man as much as a limp dick, especially a limp dick 2 or 3 nights in a row. Most guys, by at that point, are ready to kill themselves. The turn actually occurred because many years ago, I was really interested in telehealth. Founded the second old telehealth company in the United States. This goes back in the early 2000s. Why? Because I thought I wanted to empower people with knowledge that physicians would apply. They weren't motivated by secondary gain. Secondary gain, money. What people tragically in the United States and throughout the world, actually, we get the healthcare that can be billed for. It's not necessarily the healthcare that we need. It might be the healthcare that we need, but it's not necessarily the healthcare that we need. We don't get the healthcare that we most want. What epitomizes that? What do people most want from a doctor? Advice. What does managed care or Medicare or Medicaid pay for advice? Nothing. So the more I do to you, the more I get paid. And this is a fucked up system. So I got interested in telehealth and giving people a knowledge that can manage their own healthcare as much as possible without doctors. So that meant remote patient monitoring technology at home. And that gave me some expertise in sense of health technology. And then I fell off a horse. So I'll tie it together for you this way. I live in Montana. I own horses. And sometimes I have the illusion that I'm one with my horse, that I'm a centaur. Now that can be a lot of fun when you're moving out really fast over broken terrain. It can also lead to problems. So I broke six vertebrae, and that got me, and fortunately my spinal cord wasn't damaged, but that got me interested in what's been done to restore sexual function in men or women with a spinal cord injury. And there were several reports in the medical literature claiming by renowned urologists they were able to put an electrode by the dental cabinet, everyone's two favorite nerves that no one talks about because they're the ones responsible for arousal and orgasm. And they were able to restore human sexuality. So I tried out on 2 rams, male sheep, and we got erection, ejaculation. We also got defecation, urination. So Darian was exactly bedroom friendly. Maybe in certain communities, maybe in Sydney or maybe London, down lower Manhattan might be okay, but it wasn't going to work for the general population. I tried it out on myself. Not that I operated myself, but a friend of mine was a urologist, professor, implant electrode right above the pubic bone. I felt nothing. Actually don't think that we yet understand how certainly how climax is produced in humans, because we should be able to control it. So what I was talking about is cardiac, like the equivalent of cardiac pacemaker, controlling sexuality, control the heart. Anyway, years later, a urology professor at the University of Utah heard about this and said, "Oh my God, I got to work with it." He wanted to count the number of nocturnal erections in men that are leading indicator of cardiovascular health. This was 4 years ago. I said, "What the fuck are you talking about? I never heard of that." How can you mean that? I mean, we all know about morning wood, and we laugh. Girlfriends laugh about it, but we don't. A healthy man, actually, one is not enough. I'll put that to you that way. You really a healthy man. I'm Darian. You look like you're like 25 years old. You should be having like 4 a night. An old guy like me, 72 years old, I should be having 3 a night. That number goes down significantly. It's a leading indicator. It predicts that we will have a heart attack. So in medicine, we treat associations. High blood sugar is associated with heart disease, diabetes. It's not predictive though. High blood pressure associated with heart attack, but not predictive. But we treat them anyway because this is this strong association. Lead indicator means you're fucked. So if a man has, a young guy like you has 4 erections, and you don't know about it because you're sleeping, and that went down to 2, you have about a 25% chance of having a heart attack in the next 2 years. It's an early sign of a heart condition. If you went down to 1 or to 0, you have a 50% chance of having a heart attack in the next 2 years. So that's profound. That's like another vital sign. The doctor, now my chief medical officer, told me about this. I thought, that's incredible. But why stop at measuring nocturnal erections? Because after all, what do guys care about more? What's happening when they're sleeping? What's happening when they're fucking? And the answer is, of course, what's happening when we're fucking. So my thought was to embed sensors into a cock ring. This doctor, like most straight doctors, never used a cock ring. I have, and they suck. It's hard silicone rings. They pinch, are uncomfortable. And for men who have compromised circulation with diabetes or high blood pressure, they can actually be dangerous. And if you fall asleep with one on, you could actually lose your dick, or at least damage your dick. In order to count the number of nocturnal erections, we have to come up with a cock ring that could be worn overnight. We have to solve the cock ring problem as well as getting all this vital data. And that's so when I got involved in this 4 years ago, I was thinking, I'm going to solve the cock ring problem. No, I had to solve it with the data. Having collected the data, I realized cock rings are for everyone. And that's really interesting. By the way, I got to mention something here for the men in your audience who are involved with women. If you want to marry someone who's into sex toys, that should be on your checklist of what you want in a partner. Because I know about cock rings because my wife we've always been to sex toys, and she's like once, twice a year, you'd buy one of these things and they suck. Anyway, that's the background story. I collided with a horse. I've always been really interested in sex, and I've done research. So it took a doctor with that combination of knowledge and passion, sex toys, research, cardiovascular health, emergency medicine to put this all together.
Yeah, it sounds like it. And I think we were discussing this before the show related to cardiovascular health. I was really interested in what was the link, and what you described is a shocking, powerful link there that I think also for people listening to it, that often also provides a legitimization and a way to it as well. As, wow, this is actually a health risk is what you're talking about as well.
That's right. Let's get into that a little bit more if you don't mind.
Yes.
We are all on the road, all of us, even a young guy like all on the road from erectile fitness to erectile dysfunction. We would all like to know, where are we on that road? If we got a problem, I'd like to make a U-turn or get into reverse. And if I don't have any problems yet, maybe I have a problem I don't know about it. Maybe if I track my data, I'll find out that I should have 4, but only have 2 nocturnal erections. They should be a 6 in hardness and only 4. It'd be great, of course, to take care of something, a problem before it becomes gross, because it becomes obvious down there, to take care of the problem before that. So why do urologists call the penis the canary in the coal mine of cardiovascular disease? In order to get an erection, obviously, I'm taking the partner aspect out of it, or the porn aspect. When I get an erection, you need a pump. You got the heart's a pump. You have to have a good pump. If your pump is weak, you're not getting blood to your dick. Then you have to have good pipes going into your dick, which are your arteries. And the PD5 medications that are so popular, Viagra, Cialis, Sildenafil, they put more blood into your penis. But then you also have to be able to hold the blood in your penis. And those medications don't work that way. They just put more blood in, but they don't keep it. So you got to have a good pump, good arteries, and you have to have good smooth muscle that squeezes the veins and holds blood in the penis. And you can't work those muscles in the gym. The only way to work those muscles and keep their tone up is by using it. It's use it or lose it when it comes to your dick. And it's good cardiovascular health is important, and your erections reflect it. Men who have poor cardiovascular health, they have pump failure, their arteries are constricted. But you also have to have good tone on the other side, good tone on the venous side as well. So this device, this technology, it can give people the vital signs about their most vital organ. Let's be honest, we're guys. What's your most vital organ? See, I'd say it's up there with my brain, right? Most guys go 2-3 days without sex. They're like, what's on Pornhub tonight? It's who we are. So we're all on the road for fitness dysfunction. We all would like to find out where we are on that road. We don't have, this device gives you a dashboard to figure it out.
So what's interesting, I think, here is let's dive into kind of the mechanics of the ring is a little bit more too, because we talked about the number of erections, but what's the technology telling us besides that? And what does it integrate with? Is it application on your phone? Talk a little bit deeper about that.
In reverse to answer your questions, we're in the Google and Apple store. We're in the Google stores. You can find us under FirmTech. The device has 2 sensors. The sensors basically measure how hard you are. So we do it on a 1 to 10 scale.
Okay.
Because we got 10 fingers. We think in terms of 10s.
I was wondering, what's the scale? How do
It's
you
1 to 10 scale. And so it could have been, hey, we talked about making it 1 to 7 scale. We talked about making it 1 to 100. We're 1 to 10 because that's just easier. And the device will tell you. So when we first launched the device 2.5 years ago at the Consumer Electronics Show, the database had 800 erections, probably a third of which were mine. So You mean compared to me, basically. And by the way, I do get rock hard. And in fact, actually, most men get rock hard.
Yeah.
Most men. So most men, if they have ED, it's in their, it's not in their dick. So now we have like close to 84,000, maybe, I think we broke the 84,000 erection mark last week.
Wow.
That's a lot of erections, and that's a lot of men. So now you're being, so now I'm Darian, I tell by look at you, you're probably an outlier, but nevertheless, we have many.
I'm 47, actually, just so you know. I'm not 21.
I know, I'm teasing. I would guess around 40. So maybe it's the lights flattering. I can't really see the wrinkles in the corners of your eyes, though, but the great makeup. So the 40 years old, with our database, you'd be comparing yourself to hundreds and hundreds of other men, and would tell you whether you're average, above average, or below average. And we can't fake it for you. So we have had some guys contact me and say, my wife bought the ring for me, and she can't see. I'm really got to be a 10. Help me out. But those guys all have problems. Those guys have medication-related problems. So what's the data telling you? The data is telling you about your cardiovascular health. And there are 2 research projects going on now comparing our device to other cardiac risk factors. Could be blood tests, one instance, inflammatory markers, blood tests, one instance. And the other one, it hasn't started yet, but it's going to be, there's a test called the CT calcium score, which a lot of men your age are getting. It's an insurance company starting to, I think they are paying for men your age in general. It's a screening test. So someone like yourself could know, how's my heart health at my age? CAT scan. So this study is going to both compare us to that data, because it'd be great if our device is a poor man's CT calcium score, but it's probably going to try to be both a complementary. The 2 together are going to give more information than one or the other separately. So the device will tell you about your heart health, your heart risk. If you have diabetes, hypertension. If you have diabetes or hypertension, tell you whether your sexual health has been damaged by them. We doctors stupidly prescribe medications that affect guys' dicks and the hypertensives, antidepressants in particular. And look, this device will tell you, what are these things affecting my sexual health? And if they are affecting my sexual health, maybe if I took a lower dose, maybe I should eliminate them. Excuse me. The device will tell you if you're considering testosterone replacement therapy or shockwave therapy or Botox or P-shots or some other intervention for your sexual health. You establish a baseline, and then you can measure it, as opposed to one thing that's really stupid in healthcare right now is, when it comes to men's health, is we're just guessing. If a guy your age, my age, goes to a doctor and says, gee, we'll check out my T, and then you get a blood test back, and the doctor says, yeah, your T is a little bit low, let's start you on something. There's no objective measure to the effect of that. Whereas, when I start taking testosterone and when I put patients on it, I measure I get a baseline of their nocturnal erections. How hard are they? How long do they last? How many is the man having? So if you're then going to start someone on T, you can then see what's the impact? What's the right dose? What's the right point to stop? Other than, I tell you, for my age, I'll say, hey, we want you up around 700, 800. For a guy your age, I might say 600. That's bogus. We don't treat blood pressure that way. We don't treat blood pressure with, I take a guess here. This is the average guy your age needs this particular pill. No, we get measurements, et cetera. So we make sexual health objective. By the way, I want to add with testosterone, if guys are going to be taking testosterone, the other thing that's important to make it objective is just get a tape measure, put it on your pecs, put it around your biceps, and see what happens. Because if you combine that with our tech ring tell you about your sexual health. Simple a muscle measurement will tell you about what you're trying to achieve. What do most guys want? Testosterone. I want to strengthen my dick. I want to strengthen my muscle. Why do I take testosterone? I didn't need it for my dick. It turned out I didn't know, but I did. The impact upon my body muscle strength at age 70 when I started it was significant. I think every guy I probably follow your T. Every guy over age 40 or 45 should get a baseline T test and check out and then see what it is.
Outstanding information. And do you ever encounter any resistance with your product with other physicians, colleagues, things related to that?
That's a great question. I think the resistance takes 2 different forms. One is the tendency to personalize it. So one of the things that we joke about at American Urology Association or Society of Sexual Medicine conferences where people are doctors is, you can tell the difference between a gay doctor and a straight doctor with one question. Do you use a cock ring? A gay doctor, yeah, last night. A better one? Straight doctor. Some of my patients might benefit from that, but I don't need that. That's just that male pride thing. And as I said to you before the show, if you told me 4 years ago, what do you think about cock rings? That would my attitude. They pinch, they're uncomfortable. Whereas now my attitude is, it's not about need, it's about want. Darian, let me ask this question. You use cock rings?
I don't.
Okay. Do you want to rock harder, last longer, have a more intense orgasm, be more confident, even you have a couple more drinks, be more confident, and have your partner be more relaxed because they're not worrying about you losing your erection, even if they complain to you about something in the middle of having sex? So what's the answer? Do you want that or not want that?
The answer is yes, man.
Yeah, because every guy wants that. As a matter of fact, any guy who doesn't want to rock harder, last longer, be more confident, have more intense orgasms, more likely to satisfy their partner, and put up with the fact that sometimes women can talk about weird shit during sex. These guys should have a mark on their forehead that says, "Don't have sex with me because I'm an asshole." I just want to pump off. I just want to pump up a quick one, honey, and get back to ESPN and see what's on this thing. Because every guy wants that. And I didn't understand that. And now I do.
Yeah.
So what am I talking about here? I'm talking about mainstreaming cock rings.
Yeah.
So
So how does that turn though? Like, how do you convince someone who's on a, let's say, traditional pathway, you're a colleague of yours, or many of them, to say, hey, this is a viable option, not just for what you just discussed, but also for heart health. Do you use heart health as the way in to try to do that?
Yeah, so that was the personal part.
Yeah.
The other resistance comes about, which is just what you're talking about. The doctors need to be persuaded with research, and doctors, even though politically liberal, they're conservative in the rest of thinking, they follow authority. So we have 7 published papers right now, and there are like 7 or 8 other studies that go on. Getting data will become the standard of care. Just the way we wouldn't treat a cardiac arrhythmia without electrocardiogram. We don't keep blood pressure on monitor. I wouldn't treat someone with kidney failure without following their blood. So
right.
It's crazy what we're doing when it comes to men's sexual health and urology, which is we just, hey, take pills. Pills not working, we need an implant. It's just it's not the way. So the way in which we're getting through to people is with data. And let me get to the data in 1 second. So we've had world-renowned urologists now in UK, United States, Japan, Australia. Look at the data and the research and say, we've been off course for the last 20 years. So what do you mean by off course? What doctors, one of the common mistakes in healthcare is we see the sickest people in our practices and we project from that. I'll draw an analogy to emergency medicine. Heck, I don't think anyone would drive a car at all because everyone I see who drives a car is in a car wreck. That'd be a stupid conclusion, but it's an association. Or no one should own trampolines because everyone I see who has a trampoline has a broken wrist or worse. Or no one should own guns or bows and arrows or all sorts of other fun stuff because emergency medicine, that's what we see. In urology, the academic doctors, I don't blame them. This isn't the blame them. They see the sickest people. They see the guys who can't get it up or struggle to get it up. That's dysfunction. That's a dead dick. So I'm at war with the word dysfunction because I think we're really talking about most men's are probably fitness, not dysfunction. Men who prove their fitness, it's a problem. It's not dysfunction. So the doctors, these guys who can't get it up, they're the guys who have pump failure, arterial insufficiency. Their arteries are narrowed by hypertension, diabetes, heart disease. They're taking lots of meds that are killing their dick. They have bad prostate disease. But that's 10-12% of the men who had ED. The rest of the men, they just have a problem. They get it up and then they lose it. That's the common issue for most guys with this thing. And they shouldn't call it dysfunction anymore because it's embarrassing. It's shameful. And guys are reluctant to talk about it. No, I've never had a friend even tell me, hey, I've got ED, Elliot, which maybe I have because I'm a doctor. They want pills. And actually, when you talk to them, the pill's going to have placebo effect because their problem is they get up and they're losing it. So I have had guys I don't want to exaggerate. There were guys who struggle to get it up, but most guys get up and they lose it. So what's going on with these guys? It's everything from things that guys don't want to talk about with their partners, which is your pussy too loose. This position is boring to me. I can't keep it up when the baby's next door. I got stress and work. Could be alcohol as well. Could be recreational drugs. Could be medications that doctor put them on. All these things in combination. But every erection, if a guy gets an erection, every erection ends with blood leaving penis.
Right.
The PD5 medications put more blood in, go ahead and take them. But if you really want to solve the problem of getting erection and losing it, put a ring on. All men, in my opinion, should put a ring on. Just all women fucking use vibrators today. I'll prove to you, Darren, here's my challenge to you over the next 2 days. You are going to prove to yourself that you have venous leak. So I want you to go to wherever you go to when you're alone. Pornhub, XNXX, XHamster, wherever you go to. Get rock hard. And then walk away from stimulation. And you're going to lose your erection in 25, 35 seconds. Then get rock hard again and put a ring on. Our ring, of course, but any ring will do. Put a ring on. And you're going to stay hard for about two and a quarter minutes. Toss into Dalafil, 10 Dalafil, you get about another minute out of it. So what's that telling you? You put a ring on, stay harder longer. You're holding blood in your penis more effectively. But here's this major male problem that the doctors have totally fucking missed, and they should have got it because it's obvious to everyone when you think about it. And I'll get to the data, how data confirms this in just 1 second. When guys like, I'm talking about straight guys, when you're like 12, 13 years old, you hold a girl's hand. Heck, you just inhale the perfume of a girl next to you in class. You did a hard on. It doesn't happen to you at your age. If it does, you're an outlier, dude. Then you're really a stud. That doesn't happen to you at my age. I don't know any guys this happen, but maybe once in a while, in your 20s, you get a spontaneous erection. Doesn't happen. You can be just as turned on up here, but it doesn't happen.
Yeah.
Because we just don't get blood and retain blood in our penis what we do when we're younger. So here's what the data shows. 84,000 erections, documented erections. The doctors are thinking, we doctors actually know that the incidence of erectile dysfunction, I'd rather call poor erectile fitness, but erectile dysfunction is up 10% per decade, starting at your age. At my age is 70%, age is 45%. The doctors were expecting that the firmness of sex erections would go down as the incidence of erectile dysfunction went up. The number of nocturnal erections would go down. The firmness of nocturnal erections. And that's only true for the 10 to 12% of men who struggle to get erections, the guys with angina, the guys with poor diabetes or hypertension. For most men, things only start to deteriorate a little bit in the late 60s and early 70s. So why are men having more ED, but yet they're getting erections at night that are firm? And their sex erections, they do have sex, are firm. The problem is on the other side. We just don't keep blood in our penis as long as the way we did when we were younger. And actually that problem starts occurring really early. And the solution for most men is a ring. And I'll illustrate that with a fight that I had with my wife. So about 2.5 years ago, and I think a lot of guys relate to this, when I first came up with the form of the rings, comfortable elastomer, doesn't block the arterial blood in, safe, comfortable cock ring can be worn for a long period of time. I live in Montana. In the middle of having sex, my wife says, "Oh, I forgot. I left the garage door open. It's fucking snowing outside. It's 10 below." There isn't a guy in the world. There is the woman in the world who's going to jump out of bed and say, "Don't worry, honey. I'll take care of it. You just you stay there and keep on playing with yourself." That's not the real world. It falls on the guy to gird his so I went downstairs, closed the garage. Not that the rear door of her car was open. She must have been bringing in groceries.
Yeah.
I'm coming up the stairs, and my wife said, "Oh, you know the tequila you bought me that I like so much? You poured me tequila on the rocks. Oh, don't forget the lime." Now, I'm a guy, and I've been married, that time, for 35 years. My reaction would have been, "What the fuck? You fucking ruined our night of love making. Get your own fucking tequila. We're not making love tonight. I'm going to bed." Because that's my guy. That's 90% of guys would react that way.
Yeah.
So instead, I come up the stairs, and I still have a hard on because I got the ring on. Now, a guy who has a hard on is in a very different mindset than a guy who just lost his erection because his woman told him to close the garage door and then to get her pour her a drink. She laughed and she said, "The garage door was true. Tequila was a test of the ring."
Oh,
So that's the power of that's the difficult guys don't understand. That's the power of a ring. It deals with distractions, it deals with friction, and I know from speaking to a customer that the story I just told you is not uncommon. It's not uncommon, and that it helps. The ring is a game changer for men and for their partners. The data is really valuable. Getting back to that, I got into this with the data. The data will tell you about your cardiovascular health and the health of your favorite organ. probably at least my favorite organ. Both myself. I mean, my organ, not your organ. The data is really valuable. And when I saw that my data was normal, and now my data is I'm actually a little bit above average, Darian.
Oh, good
now
for you.
Data, yeah. And Darren, I hope that same thing is true for you too. So it's like seeing your electrocardiogram is normal. If you know,
Right.
great, or seeing your lipoproteins are normal. Your blood pressure is good. It was a very important, satisfying data point about, I do try to keep my health. I don't smoke. I do something to success, but I don't smoke. And I'm concerned about, I work out several times a week, et cetera. And it was good to see that. But the ring itself is a game changer in terms of my sexual performance and my wife's confidence, because as you get older, this rush to orgasm because you're both insecure. I lose it. With a ring on, we make love a lot longer, and my orgasm is more intense. My wife says she's glad the kids are out of the house because I'm loud for the first time. I've never been loud. Darren, you loud in bed?
I wouldn't say I'm super loud. No.
Yeah. I think you try a maximum performance ring. That could change.
I have a 13-year-old in the house still right now. So I have a good question here for you. So this show was primarily listened to by fitness professionals, personal trainers like myself, group X instructors, whole thing. I want to integrate what you're talking about into the daily practice of working with clients, but specifically, especially the intake process. When you're first working with clients, how can we talk to clients about their sexual health and their cardiovascular health in a way that doesn't push the client away when they're coming to us? And it actually legitimizes why they're coming to us for their health and well-being.
I think it's important for men to know this. The number of nocturnal erections, the duration of firmness, is a leading indicator of cardiovascular health. It's much more of an indicator of the cardiovascular health than the electrocardiogram, which is probably going to be normal. Even the electrocardiogram is very specific when you have a problem, but it's insensitive, meaning that if you have a problem, you might have a problem, but it could be negative. And that's a motivator. I mean, that's a vital sign. And people who are in poor physical condition, and I see this with my both customers and patients, they can actually track the improvement in their cardiovascular health through their nocturnal erections. So I don't have large numbers about this, but I have had men who have true nocturnal erections, and they're weak, they're 4.5s, and they then lose weight, eat better, work out with a trainer, and they will adjust their medications, and they will see an improvement. They'll go up to nocturnal. Their weak nocturnal erections were a 4 or 5. We'll go to 6 or 7. And I think sex is a profound motivator for men. Yeah. It's awkward to bring it up. I actually discussed this with my trainer, whether he actually ever discuss with these guys, hey, you have morning wood? Did you have it? So you're right, Darren. There is this reluctance on the part of, because doctors, same thing too.
Yeah.
Doctors never take sexual histories. That's, on the hand, they should. And so I think so should trainers. I mean, a lot of the guys that come into you have that in the back of their minds.
That's what I'm saying. Like it's probably there, but we're not trained to actually even do an intake about this. Or even, and there's a two-way potential embarrassment for both people, but they're thinking of, so I'm thinking as a vital sign, shouldn't I be talking about this during my intake with clients, but how do I do it in a way that is it, like you said, like you guys, do you have more?
I talk about erectile fitness.
Yeah.
We're going to improve overall fitness, but your erectile fitness is part of that. It's awkward. But the question that I ask is, if I ask whether guys, I use my hand to illustrate, is your problem do you have a problem attaining erection, or do you get erections and then lose them? If they have difficulty attaining erection, you're right. You could be actually saving their life, but certainly saving them from medical catastrophe if you can get them to get their data. Because we've had 2 men get cardiac catheterizations that I'm aware of, because their wives bought them the device, because their wives were worried about it.
Yeah.
We've had 2 young men who were extremely fit. I'm talking about guys in their 20s, the guys who look like they could tear my head off. Not yours, of course, but mine. my trapezius muscles are probably weaker than yours. But their dicks weren't working well because they were taking steroids.
Oh.
And one guy stopped. Now as a kid, his wife is thanking me. I'm actually having dinner with him.
That's awesome.
As you have to hear in Egypt. The guy's like 28 years old and still looks ripped. He didn't actually need to be doing what he was doing. It gave him a little bit of edge in competitions, but what's more important, the health, your heart health and the health of your penis and having children, or getting the, and we had another guy who actually had an adrenal tumor
Oh,
and also looked really fit, but he and his partner had noticed he was gay and noticed deterioration in sexual performance, had low T, then bought our device, and only was having one nocturnal erection per night. He still functioned sexually, but he wasn't where he should be.
right.
And he was a customer, not a patient, but his partner sent me an email thanking me for the device that helped him to identify what his problem was. Getting back to your question though, I think you got to ask. I think and I think we talk about it in terms of fitness, it can help.
Yeah, I think the packaging of how you put that into play there is really important. This is just fascinating. One reason why I love doing my shows, because it's just attacking topics that we are afraid to discuss. And sexuality, I have a long history of discussing sexuality on my show for over 6-7 years. And I just think we have to drop this stuff, like the facade of we can't talk about. We have to. There is a huge actual health risk factor here that we have to discuss.
Yeah, as I said, I was ignorant about this, and I'm a doctor.
Yeah.
If you had asked me a few years ago about nocturnal erections and their significance, I didn't know, and most doctors don't know, and most doctors are embarrassed to ask and say anything about it.
Yeah, that makes a lot of sense. Dr. Justin, I really appreciate the opportunity you've given me to talk to you about this. And I know company's been very generous providing a discount code, which we're having the show notes for the Firm Tech ring. So you can check that out in our show notes. By that, you get a discount, Far Side of Fitness, with the show here. I'm very grateful. And you're in Egypt, you're doing this with me. So I really appreciate you giving me the time for that.
It was fun. And again, men as they get older in the 40s and 50s, they really should put a ring on, get good data, and improve your performance.
Thank you so much, Dr. Justin. I appreciate you.
You're welcome.